নমস্কার। উজ্জ্বল পাত্র, শরৎপল্লী, কথাগুলো জড়িয়ে যাচ্ছিল, এখন ভালো আছে। অর্ণব কুন্ডু আর সঞ্জয় সেন।
Namaskar, I am Dr. Arnab Kundu, Senior Medicine and Critical Care Consultant at Vivekananda Hospital, Durgapur. Very recently, we have a patient who is a known hypertensive patient. He presented with history of sudden onset, slurring of speech and right side weakness. And initially, the provisional diagnosis in emergency, it was a left MCA stroke, and we admitted accordingly. Urgent CT scan was done, but the CT scan didn't show any signs of any infarction or hemorrhage. Rather, it showed some signs of inflammatory granuloma with a significant perilesional edema. And the differential diagnosis at that time, it is a case of neurocystic sarcosis, that is an CNS cyst of tinea solium. And then we confirmed it with MRI with contrast of brain, and immediately after the initial provisional diagnosis, we started him on antihelminthic drugs, that is albendazole, after steroid priming, to tell everyone that in case of such cases of neurocystic sarcosis, the treatment of choice is definitely antihelminth like albendazole. But before starting the drug, we need to decrease the perilesional edema, and we need to decrease the chances of further inflammation inside the cyst, where if the cyst, the helminth is alive and dies with albendazole. So it can precipitate seizures and even further deterioration of neurological signs. So initially we did steroid priming. After that, we started on albendazole therapy, and very magically within 48 hours of starting of treatment, patient regained all his weaknesses and started having normal function of all the 4 limbs, and the slurred speech was converted or came back to normal speech. We treated him in his house for 5 to 7 days. After that, the patient had no neurological deficit, and we discharged him on medication to his house. So this was an interesting case, and at the end of the day, we found the patient to be very happy and satisfied with the treatment we did for him. Thank you very much.